So next we are going to demonstrate how to insert a Ryles tube. A very basic question you should not forget. This is a picture showing you Ryles tube. You can see the Ryles tube has a lead balls here. In the tip there will be two lead balls. If you see very closely, there are two lead balls inside. And you have a line. What is this line? This is a radio opaque line. You can see this is a radio opaque line going on the Ryles tube. And you can identify the Ryles tube by seeing the lead balls in the tip and a line running like this, which is a radio opaque line, and you have some 3 to 4 holes in the tip. So this is a Ryles tube, also called as nasogastric tube. This is a nasogastric tube called as Ryles tube. How to insert the Ryles tube? First point you should not forget, keep the neck in flexed position. So the best position is Fowler's position, sitting with neck flexed. That is the best position, sitting with lightly neck flexed. So in this neck flexed position, put lignocaine jelly in the nose. Whichever nose you are going, nose opening you are going to put lignocaine jelly, and you have to very carefully, slowly push it. So you should not push it. You should ask the patient to swallow. You have to ask the patient to swallow. Patient will swallow, and you can sometimes see it is coming out through the mouth also. Slowly, you have to push it through the nose like this. Ask the patient to take sips of water to swallow. So naturally it will go into the stomach like this. So it will go into the stomach. So please don't forget, you have to put the tube here and just don't push it like this. If you go and push it like this, you will injure the cribriform plate and you may have bleeding from the nose. Push it very slowly. Ask the patient to swallow. Once they swallow, the tube will find its natural way to the esophagus. See, you can actually, this is a mannequin, so I am pushing. Otherwise, you have to ask the patient to swallow until the tip goes into the stomach. So this is done very slowly. Don't push the tube. Please remember, don't push the tube. Ask the patient to swallow slowly. This is done in sitting with neck flexed position called as Fowler's position. Now, how to know the tip is in the stomach? Nasogastric tube is put for stomach. How to know it is in the stomach? Very simple. You have many local methods, like most of you would have done this during your internship. You will push syringe and hear the whoosh sound in the epigastric region. That is not the ideal method. If you push syringe, you will hear a sound in the epigastric region. That is not the ideal method, but still it is done in practice most of the places. The ideal method is aspirate the fluid. The fluid coming out is not decision. You have to aspirate the fluid. Put the fluid on a litmus paper. You should have a litmus paper. On the litmus paper, if you put the fluid should show acidic medium. You should not have any other color. It should become acidic. So the litmus paper test is the ideal method. Since it is not commercially available in all the places, we go for the method of pushing the gas and auscultating in the epigastric region. That is commonly used by most of the interns as well as surgeons. So, but now some important points I want to tell you. What are the places where Ryles tube should not be inserted? 3 conditions where Ryles tube should not be inserted are: number 1, kerosene poison; number 2, corrosive injection; number 3, base of skull fracture. If there is already a base of skull fracture, if I put the tube, it will go and penetrate into the skull. Please remember, you should not put the tube in base of skull fracture, kerosene poison, corrosive injection. You should not put this Ryles tube. So Ryles tube is in position is identified by aspiration and testing for pH by litmus paper. And one another question is being commonly asked nowadays: how to find out the ideal length of Ryles tube for me? For example, I am the patient. If you are going to find out Ryles tube for me, you should take a tape and measure from nose to ear and from ear to xiphisternum. So this is how you should measure the ideal length of Ryles tube. So ideal length of Ryles tube is measured by a rule called as Neck's rule. Nose to ear, ear to xiphisternum. So this is ideal length for a Ryles tube. When I am going to insert, because everyone is not of same height, some of you will be short, some of you will be tall. So we should know what is ideal length of Ryles tube. Let me ask you 2 questions from pediatric surgery. A baby, when I am putting a Ryles tube, for a baby I am putting a Ryles tube. The Ryles tube is coming out of the mouth like this. The Ryles tube which I have put is coming out of the mouth like this. What is the cause? So which I have put through the nose is coming out of the mouth. This is called as coiling of Ryles tube due to esophageal atresia. In a case of tracheoesophageal fistula, in a newborn baby, when I put the Ryles tube through the nose, it will come out of the mouth. Please remember this point. Another condition, when I put the Ryles tube enters the chest in which condition? So the Ryles tube enters the chest in case of diaphragmatic hernia where the stomach has gone inside. So stomach has gone inside, so the Ryles tube can be found in the chest. So Ryles tube, when I put, goes into the chest is seen in congenital diaphragmatic hernia. The two cases where Ryles tube will have peculiar findings is Ryles tube coming out of the mouth is at esophageal fistula or tracheoesophageal fistula or atresia. And when the tube goes into the chest, it is because diaphragmatic hernia, stomach has gone here. Don't forget these two important points. So Ryles tube is a common basic work done by interns. You should not make any mistake in Ryles tube. And the only complication you can cause in this Ryles tube is pushing it. You can go and injure the cribriform plate. So please remember, you should not push forcefully. Ask the patient to swallow slowly. So that is ideal for Ryles tube. So Ryles tube related points you should not forget.
So welcome back. We are now going to discuss the most important job by an intern is to put a Ryles tube or a nasogastric tube. Okay, don't forget this tube. You should understand everything about this tube. The tube is made up of material which is like a vinyl or a rubber containing. So this tip is having a blunt end. So the blunt end tip has a radio opaque balls are there. Small balls are seen at the tip. Small radio opaque balls will be seen at the tip, which can be seen on X-ray. And you can see there are many holes. On the tube, you can see 3 to 4 holes are there in the tube, which are seen on the tip. And now, as you keep moving on the tube, there will be a line, radio opaque line running all along the tube. This is a radio opaque line running all along the tube. And there will be marks like this, 1, 2, I'll show you more clear. And there is a color coding according to the size, color of the Ryles tube. So we have different colors like Foley's catheter, we have a different colors. So use a smaller one for small children, and for adults you can use a bigger one. Nasogastric tube also has similar color coding. So just remember, this is an orange color coded nasogastric tube. You can see the tube is having many markings here and there. This is 1 mark, this is 2 mark, this is 3 mark, this is 4 mark. Apart from the lead balls in the tip and apart from the lines there are 4 marks. What are these marks? I'll show you what are these marks. So the range of the tube is from 6 to 18 French. So range of the tube is from 6 to 18 French, and adults we use 14 to 18 French, and for children we use 10 to 14 French. So adults 14 to 18 French, children 10 to 14 French Ryles tube is used. A common type of Ryles tube will be 125 centimeter in length and has markings at 45 centimeter from the nose. From the nose 45 centimeter, 55 centimeter, 65 centimeter, 75 centimeter. So when I pass the tube, when I see the first hole, I am sure I am at 45 centimeter. Then I pass it, I am at 55, 65, 75. Like that, there are 4 marking points. Don't forget, this is at 45 centimeter. Means what? You have crossed the OG junction. 55 centimeter means you are in the stomach. 65 centimeter means you are in the pylorus. And 75 centimeter means you are in the duodenum. So, OG junction, stomach, pylorus, and this is duodenum. This you can confirm seeing the markings. In fact, no need to even take an X-ray. Without taking an X-ray, we can tell what centimeter it is present inside. So this is the basics of Ryles tube. You should not forget, Ryles tube should be very carefully inserted. Okay, very carefully inserted. We have to put a lignocaine jelly to the tip, and in the nose which you are going to insert, put a lignocaine jelly and pass this in a patient in Fowler's position. In otherwise, it is like a sitting with neck flexed position. That is ideal position. Sitting with neck flexed position. Sitting with little, how will you eat? We sit and flex the neck and eat. Sitting with neck flexed position is ideal position to put the Ryles tube. So now I am going to pass the Ryles tube through the nose. Don't go towards the base of skull. Don't pass it towards the base of skull. Always slowly pass it towards the hypopharynx. Don't go towards the base of skull. You may injure the cribriform plate and you can cause epistaxis and CSF rhinorrhea. Please remember, don't pass the tube like this fully. Go and turn it towards downwards. When the patient is in flexing position, automatically it will go downwards only. When you put in extended position, it will pass upwards. So that is why we are asking the patient to sit with the neck flexed. Automatically it will go like this. So please don't forget, sitting with neck flexed, the tube is passed into the esophagus. Ask the patient to swallow. Small sips of water can be kept in the mouth and ask the patient to swallow. Don't push. As the patient swallows, it will go slowly down. And once you are sure you are not entering the trachea, you can pass it very casually. So if the tube is entering into the trachea level, they will start having cough. Cough and aspiration may happen if you put it in the trachea. So you can easily note it is going into the esophagus by slowly passing it very carefully in a sitting and neck flexed position. And there are 4 side holes. When you pass the tube, there are totally 4 holes. So these 4 holes are used to either give nutrition or to aspirate the contents from the stomach. So these holes are at the distances to the tip are like this. So if the holes are like this, we have to see the tip holes are at various distance. You can see from the tip it is at what centimeter and all, it is mentioned in literature. So the catheter tip 95 mm, 73 mm, 51 mm, 28 mm respectively. The distances to the catheter tip, for example, this is the tip. From here you can see the holes at 28 mm, 51 means 2.8 centimeter, 5.1 centimeter, 7.3 centimeter or 9.5 centimeter. This is not important. Just know there are 4 holes. So 4 holes are there which are going to function with a lead ball in the tip. So how to know what is the ideal length of Ryles tube for a human? So because not all of us are of same height. We are, some of you are short, some of you are tall. So you can know what is the ideal length of the tube by taking a tape. Nose to ear, ear to xiphisternum. So nose to ear, ear to xiphisternum is the OG junction. So you have to take a tube, nose to ear, ear to xiphisternum, called as neck's rule. So this is the minimum length you should use. You should not use less than this. So neck's rule is a rule used to identify the tip. But neck's rule, according to neck's rule, goes only up to OG junction. Therefore, many people advise to use Nemo rule. Nemo rule is ideal length of Ryles tube, nose to ear, ear to midpoint between xiphisternum and umbilicus. Midpoint between xiphisternum and umbilicus. So that is called as Nemo rule. So Nemo rule is next rule. There are so many rules available. Next rule is for adults. They used to tell Nemo rule is for children and all. But whatever it is, we have to ensure the tube is in the stomach. Okay, we should ensure the tube is in the stomach because it is called as nasogastric tube. So now I have put the Ryles tube very carefully into the stomach. As you are passing slowly, the tube has entered the stomach like this. Now how to know the tube is in the stomach only? The commonly used method as interns is we take a 50 ml syringe, and with the 50 ml syringe we push a gas. We will see the sound by hearing with a stethoscope like this. So push a gas and you can confirm it, you are in the stomach. This is only an initial method, okay? This is only an initial method to confirm. If you are going to feed this patient with a nutrition like feeding nasogastric tube, if you are going to feed, before feeding I should confirm it is in the stomach only. Because if I am going to feed it in the lungs, patient is going to die. Therefore be careful. So you should confirm before any starting feeding. Confirm the tip is here only by doing what test? The first test is aspirate. Aspirate and test the pH. pH will be acidic pH, less than 5. That is acidic pH will be there. But every time it is very difficult, we have to send it to lab to test for the pH and all. So therefore we use X-ray. Commonly used method is X-ray of the chest and upper abdomen, showing you the tube is in the upper part of the stomach. So two methods you can use. Either you can use a pH testing or you can take an X-ray. So you can see a picture showing you classical X-ray. Tip is in the upper abdomen. Okay, the tube is in the upper abdomen. So no doubt it is in the stomach. I can now start a feeding. So there are some interesting questions. In a newborn baby, when you are putting a Ryles tube, when I am putting a nasogastric tube in a newborn baby, the tube is going into the chest. Can you see? The tube is entering the left side of the chest. What is the cause? I have taken an X-ray, and before starting the nutrition for the baby, I am seeing an X-ray. X-ray shows tube is in the left side of the chest. It is congenital diaphragmatic hernia. Please don't forget, it is congenital diaphragmatic hernia. If I pass a tube in a newborn baby, the tube is going in the nose and coming out of the mouth. It is called as coiling of Ryles tube. What is it? It is tracheoesophageal fistula. Tracheoesophageal fistula with the esophageal atresia. A newborn baby with a tracheoesophageal fistula and esophageal atresia, when I pass the tube through the nose, it will come out of the mouth. When I pass the tube through the nose, it goes into the chest. Is congenital diaphragmatic hernia. Coming out of the nose and coming out of the mouth is tracheoesophageal fistula. Okay. So now, what are the contraindications for Ryles tube? Please never forget this point. When all places you should not put a Ryles tube. Number 1, you should not put a Ryles tube in a base of skull fracture. In a base of skull fracture, already patient is having CSF rhinorrhea, epistaxis and all. When I try to put the tube, I can cause more damage. So don't put Ryles tube in a base of skull fracture. Kerosene poison. You should never put a Ryles tube, because the kerosene which is in the stomach, now if you try to put the Ryles tube, they will vomit and they will aspirate. The problem in kerosene is lung damage. They will cause more damage in the lungs. Corrosive ingestion like acid consumption, alkali consumption and all, you should not put. If I put it, the acid which has gone to the stomach will come back and cause damage of the esophagus. Corrosive ingestion. Esophageal varices. In an esophageal variceal bleed, if there is already a bleeding and if I put a Ryles tube blindly, I can go and cause damage of the varices more. So these are the 4 places where you should not put Ryles tube. So where are the places where nasogastric tube is contraindicated as base of skull fracture, kerosene poison, corrosive ingestion and esophageal variceal bleed. Okay, we will do it for normal hematemesis patient. Not a case of DCLD, decompensated liver disease with the variceal bleed, you should not put nasogastric tube. Please don't forget, nasogastric tube is a basic question. You should not make mistake in nasogastric tube. It's a simple and basic topic. Okay.